There's medical advice this evening to workers in the BPO sector where holding urine for lengthy periods is concerned. At least one physician is pointing to increased risk of urinary tract infections. Romada Lyons explains.
Financing tertiary studies, goals some young Jamaicans say they've been able to check off their lists because of earnings in the BPO sector. But it takes strategy. Unlike others who complained about working conditions, some admit that they aren't being prevented from relieving themselves. They do it purposely, taking on additional hours to benefit from overtime and bonuses. That's why physician Dr. Adrian Kaur says they're at an increased risk for urinary tract infections.
Prolonged sitting and work-related stress are actually linked to increased risk of lower UTI symptoms and infections, right? Particularly in service and call center type jobs. Now, the evidence will tell you that regular, complete emptying of the bladder and adequate hydration are recommended to reduce UTIs.
And there's a charge to companies as well.
Workplace interventions and policies should be set in place to ensure frequent and unrestricted access in an effort to, prevent UTIs among their workers.
He says the treatment can take between 5 to 7 days. The cost of treatment, however,
is dependent on whether or not the patient has insurance or whether or not it is the brand of the drug or the generic that is available at the pharmacy. So let's take, for example, Augmentin. If the pharmacy has available Augmentin, then you're looking, depending on the pharmacy, of course, at around $7,000 approximately for a 7-day course.
Dr. Kaur warns that women are at an increased risk for various reasons.
The urethra, which is that tract along which the urine travels, is shorter in females when compared to males.
There are some worst case scenarios, as there are complications associated with recurring infections.
You may have impaired quality of life because it means then that you'd have excessive urination, having to run to the bathroom urgently, or else you may end up wetting yourself, burning on urination, right? You want to also talk about things like kidney damage. And if the infection spreads to the kidney, it could actually go to the bloodstream and cause death if not treated promptly.
Romada Lyons, TVJ News.